Disclaimers. This meeting is being recorded and live streamed on TVW. The meeting will be shared on the State v. Blake ESB 5476 webpage. This recording is open to public disclosure, so please do not disclose any private or confidential information. Next slide. There will be 10 minutes at the beginning of the meeting for public feedback and 10 more minutes near the end of the meeting reserved for comment. Each person will have 3 minutes to provide feedback. If you are not a committee member and would like to make a comment during a different part of the discussion, please raise your hand for facilitator awareness, and public comment on that topic will be invited before moving to the next item. If you don't have a chance to provide feedback during the meeting, you can always submit it via email at any time to HCA ESB 5476@hca.wa.gov. And with that, we'll just move right into roll call for today's meeting. Michael Linger.
Present.
Amber Leaders. Senator Dingra. Senator Braun. Representative Davis.
Good morning.
Morning. Representative Griffey. Caleb Bantagreen.
Good morning.
Morning. Don Julian Saucier.
Good morning.
Morning. Janelle Wolf. Alexi Orr. Amber Daniel.
I'm here.
Good morning. Brandy Flood. Stormy Howell. Chad Enright.
Morning.
Good morning. John Hayden.
Good morning.
Good morning. Nikki Lewis.
Good morning.
Morning, Nikki. Sherry Candelario.
Good morning.
Morning. James Tillett.
Good morning.
Good morning. Christine Lynch.
Good morning.
Good morning. Sarah Gillard. Donnell Tanksley. Malika Lamont.
Present.
Good morning. Addie Adwell.
Good morning.
Good morning. Kevin Ballard.
Good morning.
Morning. Hunter McKim.
Good morning.
Good morning. Curtis Klingenberg. Representative Taylor. Representative Mossbrucker. All right, welcome everybody. And for anyone present who this is maybe your first meeting, my name is Michelle Martinez. I am the Substance Use Recovery Services Advisory Committee Administrator. And with that, I will hand it over to Michael Linger, our committee chair.
Thank you, Michelle, and thank you for everybody who prepared for our meeting today. We come off a series of meetings of panelists, giving us different perspectives across the state into the work that we're doing. Today, we're going to come back to looking at the plan and some activities that have happened as a result of the plan. We'll get a little bit of a report on that. We'll get some information about Recovery Navigator program and have a little bit more conversation in a few other areas as well. So again, for all that helped and contributed to the panelists over the last several months, we want to again thank you for those. Those were really good opportunities to hear from a variety of folks across the state. I also want to take a moment this morning and welcome Nikki Lewis. Nikki is our newest member to SURSAC, and she's representing the Washington Health Care Plan. So Nikki, if you wanted to come on and just introduce yourself and a little bit about your interest of participating in SURSAC, this is an opportunity we offer up to new members. So I would ask you to come on if you're so inclined and can share with us a little bit about yourself.
Absolutely. Thank you. Good morning. My name is Nikki Lewis. My pronouns are she, her, and I am humbled to have been chosen as a member of this committee. I'm currently an addictions administrator for AmeriGroup Washington in their Medicaid division and have been a licensed substance use dependency professional and licensed mental health counselor for over 13 years here in the state of Washington. I've worked in a variety of settings, providing substance use and mental health treatment, including working in residential treatment facilities, withdrawal units, partial hospitalization, treatment centers, and intensive outpatient settings. I'm really passionate about advocating for persons dealing with the impact of substance use disorders, as I believe they're often overlooked, misunderstood, and underserved. I'm honored to be a part of this important work and appreciate the opportunity to represent the Association of Washington Health Plans on this committee. Thank you very much.
Thank you again for joining us, Nikki. Really appreciate that. And Curtis Klinkenberg. Curtis, you're not on. I know you weren't in roll call. Have you joined us last couple minutes? I think we had the opportunity to have Curtis on with us at the last meeting, and but we did not offer him an opportunity to introduce himself to the group, so we wanted to catch up on that this month. We will just move forward, Michelle, and then we'll ask him if he's so inclined in November to share a little bit about himself. So with that, again, thank you all for joining us as we turn another page on a new month here in October, and look forward to a great fall working with you all. So I'm going to turn this over to Blake Ellison, who is our facilitator of these meetings, and he does a great job in offering opportunities for the public comment. So Blake, I'm going to turn it over to you at this point.
Thank you, Michael. Good morning, folks. If anybody from the public would like to make a comment here, now is the time, as Michael said. We'd like you to go ahead, and if you want to do that, please raise your hand virtually, and we will get to your comment. Thank you. Again, time for public comment. If anybody wants to make one, please just raise your hand in the chat. Give some kind of signal to us. Michelle, I'm not seeing anything right this moment. Last call for public comment. Okay, I think Brianna, then you are up. Brianna, are you with us?
Yes, I'm here. I'm
All
in
right.
the conference room.
Oh, okay. Thank you. Whenever you're ready.
Rachel, yeah. Just give us a moment. We're going to display the implementation report. Oh, I'm Brianna Peterson. I'm the technical plan developer and report administrator for 5476. Part of this meeting today, we're going to be going over the implementation report for the Substance Use and Recovery Services Plan. Each year, we are required to provide a report to legislature and the governor on December of each year, beginning in 2023, on the implementation of the recommendations put forth by the SURSAC. Part of this report includes progress towards substance use disorder continuum of care, including outreach, treatment, and recovery support services. This report also includes updates on programs that are funded out of 5476. And this implementation report will include updates from 5536. With the passing of 5536 this year, we started the report with implementation updates related to 5536, and then other general efforts from HCA that aligned with some of the SURSAC recommendations. The report is organized by recommendation. Yes, okay. Thank you. And for the annual progress report, we'll report on progress related to the 5476 programs, including host, the clubhouse expansion, recovery navigator program, and to ensure that we are providing current program details as well as any data points that we are able to capture. Some of the impacts of the programs that are had in the community. We've also included success stories from each program to really highlight more than just data and numbers, but really how it's impacting the communities that they're serving. We've also included a short recap of the conversations had during the SURSAC meetings, including the community safety panel discussion, for which we will be seeking community feedback on both the discussion themselves and how they'd like to see these inform future committee engagements and priorities. We can now go through the plan recommendations. Does anybody want to call out any specific recommendation to begin with? This is me assuming everyone had a chance to read this, so I apologize if you had not had a chance. I know we've probably sent this out on Friday, so if you want to just slowly go through them, we can do that as well.
Yeah, before we do that, we got a request. Can we make it a little bit wider?
Yeah.
They're possible to do that so everybody can see. Thanks. All right, and we have Kevin's hand is up. Go ahead, Kevin, and then we'll get to Malika.
Thank you. I just want to, I don't know, just a recommendation, maybe as I did, roll through it page by page and see if there's anyone that speaks to each recommendation rather than casting a wide net on the entire document up front, because I believe the conversation might get a little disjointed. That's just my own opinion. Thank you. I do have some comments when we do get to those points, though.
Yeah, and so some of the feedback that we're looking for is pretty much the overall structure of the report, how it's presented, how the context is presented inside, any clarity of language, and any considerations, suggestions, or questions for HCA related to the implementation for any of these recommendations.
All right. Thank you, Malika, and thanks, Kevin.
Well, I'd just like to, note for the public that we didn't receive this until 4:30 on Friday afternoon. And then we have this meeting at 9 a.m. It didn't really lend itself to being able to review the document very well. And I would like to also agree with the recommendation that we go through each area and you provide us with the content so that we know what it says. And if we haven't had a chance, if the group hasn't been able to go through it, and the highlights as you see them. I think that it's worth noting that it would have been helpful to get this before 4:30 on a Friday afternoon.
Thank you, Malika. Amber?
I was just wondering if this is a progress report from 23 to 24, are we going off the fiscal year? Are we going off the actual year? And either way, 2023 is not over.
No, you're right, Amber. We're trying to capture as much information as possible, given the information that we have currently. I will say for the data piece, we are trying to go by the fiscal year just because it allows us to go through the data and make sure that it's correct and correct any errors that we have. We are still currently going through the data as we speak, just for the fiscal year. So that's the data piece will reflect the fiscal year. These recommendations will be as we gather the information or as information that we have currently. And there is some areas where we don't have anything to report it out on just yet, but they will be included in the next iteration. But we're trying to gather the data as quickly as we can. That's why it was kind of late to begin with. We were trying to make sure that we had as much information up to date with
not only including 5536 implementations, but really what HCA is doing with those, with that legislation and beyond some of the other things that we're doing that kind of align with the recommendations that are made. Oh, the fiscal year is from July 1 to June 30.
So we're only like a quarter into the fiscal year.
Yeah, so we'll, the data that we're reporting out on is for the last fiscal year, so it'll be from July 1, 2022 to June 30, 2023.
Okay, it just seems like it's tricky when it says that the report is 2023 to 2024.
Thank you, Amber. Appreciate that. James, you're up.
I do have a recommendation for this section. Would it be possible to add like an incentive for innovation? Because I recall in some of our previous meetings, the discussion for LGBTQ respite housing was brought up. So maybe something about innovation, where if something that is really addressing a need that hasn't been met traditionally is being met, that there's support for someone to step out and do that.
Thank you, James. Any comments on that from the room? Okay, Kevin, you still have your hand up. Did you have more comments? Thank you, James. All right.
No,
there we go.
no, thank you.
Okay. All right. I think we're back to Brianna then.
We can scroll down to recommendation 2 if no one has any more comments or questions.
Amber, go ahead.
You know, I was just noticing that a lot of the housing vouchers that were put in place because of COVID are now running out, and they're kind of, at least in my community, we're seeing kind of a flood of people that had vouchers that couldn't find housing. So they got this like little bit of hope and it got yanked. And I don't know if there would be a way for us to maybe extend some COVID housing stuff through this plan or not. I know that we can't change the, fact that people can get evicted now, and stuff like that, but maybe there could be something that we could do as far as the vouchers that people have received that they weren't able to use because of lack of housing.
All right, thank you. All right, so back to the room.
Oh, just look at it myself. So would you guys prefer that I read through the implementation pieces?
I think we were looking for highlights.
So the recommendation 2 is legal advocacy for those affected by SUD. 5536 provides consultation and representation for indigenous adults facing pending charges that are faced with, I think those are SUD charges, correct? Possession. And and this provided funding for public defense to support those kinds of services. I know we didn't get into too much of the family law part, but it did cover those that are affected by pending charges or violations for possession. Any other comments?
Yeah, we had Malika, go ahead.
Sorry to kind of go back to the one that was that we just left, number one around housing, but where are we with the you know, it was brought up I brought it up last month. And I'm just wondering where we are with developing of the development of the work group that came out of those recommendations related to housing, low barrier supportive housing for folks, and just wondering where HCA is in the process of putting that work group together.
We done.
Oh, maybe
Yeah.
that's a different recommendation. We haven't gotten there yet, but just related to that. Sorry, I just am really getting into the document since we didn't get it until 4:30 on Friday, and I was on.
Sure. I thought I sent it in the morning on Friday to give a little bit of time to you all, but let me know if I'm misremembering that. But I did look into the housing recommendation, Malika, after your comment at the last meeting. And I think there's been some confusion because in the recovery services, support services subcommittee, the recommendation that came out from that was to create a work group. But if you'll recall, once it got to SURSAC, there was further discussion at the meeting, and it turned out that a lot of folks felt that there were already so many work groups and other organizations working on the housing issue that the recommendation that ended up in the plan approved by the committee was to coordinate work across those existing work groups by participation in them. So if you look at the continuum of housing recommendation that made it into the plan itself, there's language about SURSAC encourages participation and then there's a list of work groups and agencies already working on housing issues. So again, confusing because the recommendation changed from subcommittee to the plan from that discussion, but there wasn't actually a recommendation for HCA to form a work group ultimately. But because we still need to follow up on what was recommended, we're going to talk about that at the end of this meeting in terms of what to put on the agendas for the coming year, which we'll discuss either in November or December, depending on how SURSAC wants to prioritize what comes up in the next couple meetings. Do you have any questions about that?
Thanks for clarifying that HCA isn't really doing anything about it. Okay, thanks.
Okay, Rep Davis.
Thank you so much. Two quick comments. Just one on the housing bit. I think it was Amber who was mentioning about the vouchers. It might be helpful to clarify in the chat or otherwise specifically what types of vouchers. The legislature has created so many different types of vouchers. A lot of our short-term recovery housing vouchers for folks, particularly for folks leaving inpatient SUD treatment or leaving jail or people in early recovery, those, sort of 3 to 6 month vouchers, those had been distributed through the HARPS program. And then during COVID, there was some extra money and they were distributed directly through Oxford and then Walker, the Washington Alliance for Quality Recovery Residences. The legislature actually invested an unprecedented $11.5 million between the 5536 legislation and the underlying budget toward those. That's an increase over existing appropriations for short-term recovery housing vouchers. So that's one category. Then there's CBRA, which is a long-term rental subsidy targeted toward primarily folks living with significant mental health challenges or co-occurring behavioral health challenges. That's a different type of voucher, and those are long-term. So there's just honestly, I might say that we have like too many different types of programs with like very specific populations, but it'd be helpful to know which types folks are sort of running out of, because I think the legislature thinks we put all this money into housing, and to the extent that those vouchers are not matching up with people in need, that would be helpful.
Right.
And then the second point on the legal system piece, I personally just you know, my memory of the recommendation related to legal support actually had nothing to do with the constitutionally enshrined right to public defender for individuals who are charged with crimes. It was not about that at all. It was about access to civil legal aid for family law, access to civil legal aid for individuals who might have, you know, past or, you know, facing legal aid for individuals trying to vacate criminal histories and things of that nature. So access to civil legal aid for which there is no constitutional enshrined right to help individuals regain and rebuild their lives. So to me, I get 100% where HCA is coming from, trying to kind of, you know, point to things that are generally within the rough category that we're talking about that have been done. But I, for one, was quite displeased about spending $9 million in 5536. That was a last minute ad in late negotiations for public defenders and not actually for, oh, I don't know, housing or civil legal aid or family reunification or literally anything else. So I just want to me, it would not be consistent with the spirit of the recommendation to suggest that any gains were made related to that particular recommendation, other than monies that were invested in 5536 or in the underlying budget related to vacation of convictions, and which there were appropriations for that. There were no appropriations made for family law and other civil legal aid needs, which are many for individuals with SUD.
Thank you, Rep.
So-
Davis. We'll go ahead and get to Michael, and then we have Caleb and Malika.
Thank you, Blake. And I just was going to respond to a couple of things that have been said so far. We can move on. One, we do have a number of housing committees, and so that's what Michelle was talking about, is that we will share that in a future meeting on how we can participate in that. That's later on the agenda. And then in terms of the vouchers, there are a number of voucher programs, and I would suggest we can also give you a briefing on that in a future meeting. So we can go ahead and move on to, looks like Caleb is up next.
Good morning. I have a process question that I think Rep. Davis kind of hinted at. It seems like a lot of things happened at the very end of the legislature. And when I talked with some high-placed folks in the legislature, they indicated to me there was not enough advocacy for some of these things, which I found confusing given that this was our work for a year and many of us actually cannot advocate. I'm wondering, and we also testified, some of us, myself, 4 times to the legislature, and yet some things were done at the last minute in the legislature that seemed divergent to SURSAC recommendations and or to opioid settlement recommendations, which I know is a parallel piece of work. I know there's a lot of frustration among a lot of people, and many people thinking of just walking away from this work, given it was unclear what their efforts were aimed at or in furtherance of. I'm wondering if there's anything you would recommend to this group that makes it more likely that these recommendations might actually be heard and acted on by the legislature. Thanks.
Thank you.
Sorry,
Okay,
Caleb, was that a question to me or was that to HCA? I was unclear.
Oh, that was to you, Rep. Davis, or any of the other representatives. So basically, how this work is only becomes manifest by the legislature, and it seems like all of our effort and activities are, I would think they would speak for themselves, but then hearing that some things aren't acted on because there isn't enough advocacy, or the processes can be a bit opaque from the outside, and I know perhaps from the inside. But if there's anything you could share with us that you think would help us be more effective, I'd appreciate it.
Sure, yeah, whenever, HCA, if you want me to respond, I'm happy to in whatever order.
Michael?
Yeah, I'm just checking here with our time. So, okay, why don't we take 5 and let Rep. Davis go ahead and respond to Caleb's question. And if there's further discussion, we can go ahead and see if there's time at the end or put it on for a future meeting. But Rep. Davis, if you wouldn't mind responding, I think a few minutes here.
Sure, I'm just going to give
testimony,
you. Yeah, I appreciate, thank you, Caleb, for your candor, and I apologize for that. That's the understandable felt experience of, I think, a lot of individuals. I'll just tell you the unvarnished truth, which is the only way I know how to operate, which is like all policy in the legislature, generally speaking, but especially that particular bill 5536. I would say that the legislature receives recommendations from groups like SURSAC or, Chris, the 988 committee, or frankly any other legislatively directed committee, in the same way or a similar fashion, perhaps, maybe not the same, to the way that the governor's budget is received, which is like a starting place, and then those recommendation, and it's much better. Just like it's much better to be in the governor's budget, it's much better to be at the starting place for conversation, because then an idea has to be actively removed, or changed. So that's kind of one piece, is that the I'm not speaking for myself, but sort of the legislature as a body sort of sees their duty as like, continuing to meddle, essentially, for better or for worse, in all areas. So that's kind of one part of the response. But a part of the response that I'm particularly not proud of is, I think this bill, usually bills go through a very long process, through multiple committee hearings, policy committee hearings in both chambers, budget committee hearings in both chambers, and then on the floor. So there are at least a half a dozen opportunities to amend legislation. And very frequently, like the norm would be that if we hear strident testimony about a particular something in a bill that's compelling, we will work to amend that bill accordingly as it's getting out of committee. If I'm being honest, that 5536 was negotiated with a very small number of lawmakers, like 6 or 8 lawmakers, and only one of those lawmakers, Senator Dingra, was part of the SURSAC, and so it was negotiated in like a political pressure zone that probably had a lot less to do with public policy or evidence-based policy, and a lot more to do with political pressure and the governor's pressure to be done one day. And so it was basically like, I hate to say it, but like backroom dealing and then rubber stamped. And it was not a collaborative process. There were no, we were told that no amendments would be accepted on the bill. We were told that we would finish in one day. So it was not a deliberative process. There was no legitimate debate. It did not go through the normal process, because they basically like scrapped the bill that had been discussed during session and worked up a new negotiated bill that everyone agreed to, and then everyone was expected to vote for, which I obviously dissented, but I was a little bit of an anomaly in that. So this bill was especially non-democratic in the way that it was arrived at, and I think I'm ashamed of that.
I appreciate the explanation. I hope people don't see this as a distraction, because it's whether our work actually has any impact. And I wonder if you have any further recommendations for us. I mean, it's ultimately, as you said, it's a process we really can't do anything about. But I don't know if you, other than the conversation we're having right now being public, which maybe is modestly helpful, any other thoughts from you or any other representative about how we can be more effective as a committee and making our recommendations move forward?
Sure, and I don't want to hijack the committee's meeting with a colloquy here, but in short, I think that the tools, generally speaking, for any of advocacy of any kind is public testimony at hearings. I mean, lawmakers actually listen to testimony and craft amendments accordingly when we miss the mark. Participating in editing and reviewing draft legislation, if which are frequently batted around, through stakeholders, track changes. Individual meetings with key lawmakers who are on key committees or in decision-making authority to convey particular things. Either the folks on this committee either have professional or lived expertise, or both. That's incredibly influential and compelling. I would say that those are the primary levers, and then certainly calling, emailing, but really individual meetings with lawmakers and public testimony are crucial. And then having groups, right, sort of sign on or endorse or say, hey, you missed this, and this is really important to like X, constituency or group or stakeholder group. The legislature cares a lot about stakeholders, not just SURSAC, but like other, behavioral health heavyweights. So those are some initial thoughts.
Thank
But
you.
I would say that bill is not really representative of the way that we do things in Olympia, like at all. It wasn't collaborative among lawmakers. It wasn't collaborative among stakeholders. It was negotiated in secret, and then everyone was expected to vote for it. That is a blemish, in my opinion, on the democratic process.
Thank you, Rep. Davis. Appreciate that. Malika.
Well, in alignment with, and I agree with your assessment of the process, Rep. Davis. And what was extremely frustrating, I mean, and to hear you mention that stakeholders, there were electeds that literally said, well, it would have been nice to hear from folks that are in recovery, but they never allowed folks to testify. Like there were whole groups of people that wanted to speak to their path to recovery, that how, the moves that were being made weren't helpful, and they were not allowed to speak. And it was pretty evident from the process that their comments weren't read either. So, and this isn't an indictment of you, it is of the process, but then it has seemed to be exceptionally frustrating. And this is commentary for, HCA, is that, the recommendations that we made, things changed. Like, for example, what we just spoke about related to the work groups. We made specific recommendations related to housing that would, and they were not incorporated in the spirit with which we said them. So it's frustrating.
Thank you.
Totally understood, and happy to talk offline with anyone, but I feel badly derailing HCA's meeting, but thank you everybody for the feedback, and everybody, I'm happy to chat anytime.
Thank you. Appreciate that. I guess we're back to the room.
Yep, recommendation 3, the LGBTQIA community housing. And so in 5536, funding was provided for operational costs of new staffed recovery residences. For those who require more support than a level 1 recovery residence. We have contracted with an external partner for facilitation of the grant program to ensure that it aligns with the training under 5536. There's also the outreach to develop recovery housing. HCA is directed to conduct outreach to underserved and rural areas. Though there was no dedicated funding, we have updated an existing contract with the Washington Alliance for Quality Recovery Residences to develop and provide outreach to underserved and rural areas. Then there's training for recovery housing providers. Beginning January 1, training for housing providers will be developed. Direct harassment, communication, anti-racism, diversity, and gender-affirming behavior, ensuring grant or loan applications receive this training. Again, since there was no dedicated funding, but we have contracted with Walker to develop and provide this training for housing providers. Any comments or questions?
Yep. Deontay has his hand up. Go ahead, Deontay.
Good morning, everyone. Yeah, I wanted to ask a little bit more about the training that's supposed to be that's going to take place for the housing providers. Do you know exactly who will be doing that training? Will that be HCA doing the training, or will HCA be reaching out to other community members from the LGBTQ community to facilitate that?
So it looks like the contractor, the Walker, is going to develop and provide this training.
Who is?
Walker, the Washington Alliance for Quality Recovery Residences.
Okay.
And we'll probably be able to provide more information once it becomes available about what that training looks like and how it was developed.
Yeah, I mean, I'm considering the fact that it came through the recommendations of the SURSAC. I think it would be really great to look over what some of those training efforts may look like. Just so then we'll see what the training will look like for our folks, if that makes sense.
More than happy to take that information back and see what we can provide to you guys.
Yes, because we want to make sure that it is people say DEI and might have the pride flags in the window, but we also want to make sure that if that training isn't up to up to date, I would hope that the SURSAC folks would be able to look at some other community organizations that are leading in the areas of housing and are offering space. Maybe build your own curriculum of what that may look like. Just a thought. Thank you.
Yeah.
Thank you. Thanks, Yante. Malika, go ahead.
I'd like to clarify that SURSAC, it was not our recommendation that Walker be the provider of this training. I think that we saw through the work group process and through the current conditions that although they have been viewed as having the expertise to do what HCA wants them to do, that it has not resulted in equitable access to housing, and that is probably not the best path forward. And so I'm curious, how is HCA going to be engaging with this pair process that you all have, there was a press release put out probably about 3 weeks ago. I can't remember what the acronym stands for, but the purpose of it was supposed to be equity and anti-racism. And I mean, how do you all think that this decision-making process of who is going to be providing, I mean, you're putting essentially the responsibility of improving things into the hands of people that have not created the equity that we're asking for. And that systems feedback loop just is not effective. So I'm curious, what can we expect to have as checks and balances, since you're not listening to the work group, you're not listening to the public, and we are unclear as to how the pair process that you all are going to be engaging in this equity and anti-racism, because you want things to be felt, the changes to be felt by community, according to the press release.
Malika, I would say that I guess I'd take exception to the fact that we're not listening to work groups or the public. I don't think that's a fair statement. And in terms of PAIR, we are involved in the PAIR process within the Healthcare Authority. There is a community engagement committee that is helping guide thoughts about how we can do better at community engagement. And so we can certainly give you more information about that. I think we're doing our best to listen to the community, to the work groups, to the plan. Not all the things that subcommittees put forward for the larger group were adopted, but those that were adopted, we are trying to be transparent here this morning to share with you what was stated in the plan and progress to date. And certainly we are happy to have conversations about any of these components, like you just mentioned, in terms of Walker doing this work. I'm not sure we have the contract manager in here for that right now, but we can find out more information for you.
Okay, Deontay.
Yeah, I could just say that I remember having this conversation passionately in early April and March about recommending that reaching out to some LGBTQI community members or organizations to kind of help foster in some of that training or have them to come in and say some of the recommendations that they have. I don't know Walker or much about them, but what I love about this work group is that you are trying to blend in, have community be in on this conversation. And I just think it's important that they could be able to lead it. I mean, for Christ's sakes, we have the Say It Loud conference where you highlight and prioritize LGBTQIA community members in this state. I just really think that it would be really important, especially when we're talking about housing and where we're at, that we could be able to kind of circle back and maybe, if that is possible, circle back and just make sure that we're prioritizing people in the conversation. Because I mean, some trainings that have happened with LGBTQIA community members have been outdated and aren't diverse. And that is the scary part. And when we're talking about recovery housing towards our community members in this space, I think that we really need to think about reinventing the wheel as a collective. That's all.
Thank you, Deontay. James.
So just to speak on a couple things touched on, with Walker, I've actually done inspections for some of their houses. And so the process of making sure these homes are in good shape is really, really strong. I think one area that we could improve on is some of the funding, because I've done FCS supportive employment and housing, and we've had people take advantage, like different houses, at least in my community, take advantage of the Walker funding and kind of just cycle people out in a 3 or 6 month period real quick. And so there's not a lot of grace for them to continue housing after that if they haven't gotten independent on their own yet, or if they're still kind of struggling to find their feet in recovery. And then also with the LGBTQ housing, you know, there's organizations within our state like Peer Washington that do FCS supportive housing, and they're all of their efforts are in the LGBTQ movement. And so maybe trying to partner with something like that or an organization like that would be a really good way where we're ensuring that this needs being met, since they're already doing the FCS housing, partnering with them to try to find a way for them to have the houses and operate the houses could really help in multiple ways with that.
Thank you, James. Okay, Deontay, James, anything more that you wanted to add? Your hands are still up.
I did want to just throw out there
it.
again that Lavender Rights Project is leading some of the housing out here in Capitol Hill. I think it would be great again to invite them back to the table, especially within this space. They also have done training within this space, and I think that it would be a great asset for the state. I just wanted to throw that out there. That's it. I'll put my.
You're good. Thank you. Appreciate that. Looks like there's no more questions. We'll go ahead and put it back to the room.
Yes. Recommendation number 4, training for foster and kinship parents of children with substance use. So 5536 has the authority and DCYF working together to create a training program for parents for adolescent and transition age youth with substance use disorders. This training will cover science and education, adaptive communication strategies, self-care, opioid overdose, reversal medication, and suicide prevention. We are already starting the discussions with DCYF to determine how best to operationalize the training, and we're currently filling a vacancy that will help lead this work internally. Any comments, questions?
Go ahead, Deontay.
Again, this kind of goes back to the question that was asked during recommendation 3. Who is providing this training for this one? Is it going to be Walker again, or?
No, so this is between DCYF and HCA, and I'm assuming DSHS because they do the kinship. And so it'll be through the state agencies will be providing that kind of training.
Thank you.
Yeah.
Thank you. Amber?
Yeah, I remember this part. We talked about craft training for kinship and parents of children who use substances. Stands for community reinforcement and family training. It's nationally recognized way for people who are in people who use substances lives that want to maintain that relationship, but also know how to look for the signs and allow for natural consequences. The idea is that these caregivers who are working with children who use substances are more educated about what substance use disorder is, how it works, and are more able to empathetically connect and meet those kids where they're at, as well as not be sitting there going, I just want to help them and I don't know what to do, which is something that almost every person who's tried to help anyone with substance use disorder has said. So we want to give them the tools that they can. So I think we even named craft in that piece, as well as recovery coaching and stuff like that. So does that answer that, Deontay?
Yes, kind of. Yes. Thank you.
All right, thanks, Amber. All right, I don't see any others. Go ahead.
Recommendation 5, which is the drug paraphernalia law. So 5536 does amend the RCW concerning drug paraphernalia. It removes previous RCW language prohibiting the individual sale of drug testing or analyzing equipment. It also includes language clarifying that the prohibitions related to selling provided paraphernalia by individuals does not apply to public health programs, and includes language to allow for smoking and drug testing equipment to be provided by public health and syringe service programs. That's most of the highlights of that. Is right. Any comments, questions?
Oh.
Oh, and local ordinances related to drug paraphernalia must be authorized by state law. That's a big one too.
Ooh, that's gonna be a good one. Local
we
ordinances
didn't
related
yeah,
to
like we didn't make the
paraphernalia
recommendation.
and substance
Sorry, go
use
ahead.
have to be authorized by state. Since
Amber?
we put it in the legislature. Oh, hey.
Did you mean to
No, I had left my mic on an accident.
Okay, thank you. Malik, I thought I may have heard somebody else in there as well. Anybody have an official comment or question?
I do have an official
All right.
comment.
All right, go ahead, Malika.
So unfortunately, the state law was what was snuck in there. That second paragraph is what makes it so that there is the sanction by the state for local jurisdictions to outlaw these. And it can also impact outreach workers. So like that is the thing that is really concerning to me as a member of this group, because that was not our recommendation. Those things were those were absolutely not what we recommended. So I don't know why that is put in here as a recommendation from us, that we said that there should be or that's the way I'm reading it. And I'm sorry, wasn't able to read the whole document because I didn't receive it in time, but that we did not say that exemption doesn't actually work because of the second paragraph, the second part of paragraph 8, excuse me, in 5536.
Wasn't that the part that I think it was Brandy Flood who was saying that we had to write under that the state would preempt the field, and I think that is in there.
No, because
in section 8, the state preempts the entire field of drug paraphernalia regulation within the state, except as provided in subsection 2.
Right, and subsection 2 means gives local jurisdictions permission to outlaw paraphernalia.
So this is Tim, and I was the subcommittee co-chair for this with Amber. Malika is correct that we did ask for the state to preempt the whole field of drug paraphernalia, which would allow entities and individuals to give or permit to give drug paraphernalia, including items such as smoking equipment and other injection alternatives. The subcommittee did not recommend that exclusion that Malika is talking about, which was put in at the 11th hour related to local governments, whether that's city or county,
having the authority to regulate harm reduction supplies as it's germane within their community. So that wasn't part of the SURSAC recommendation. So just clarifying, spot on with that.
And I would like, I really feel that that needs to be removed because we absolutely did not recommend that.
I can offer a quick clarification in here. So the report is laid out so that the first paragraph or two gives what SURSAC recommended. The next paragraph or two says what the legislative response to that recommendation was. So, you know, we can't, in the plan cannot, we can't implement any part of the plan that was not supported or funded. So what we're trying to convey in the report is the chain of events and what we are able to implement. And so it goes recommendation, legislative response, and then what HCA is directed to implement, and then how, you know, our progress along that implementation. So, so there will be, you know, discrepancies here and there between what was recommended by the committee and what was passed, and therefore what we can implement. So just wanted to clarify that. And
Michelle,
yeah.
I'm going to add on to that if I may. Thank you for pointing this out, Malika and others, because I think what Michelle is describing is accurate. However, it's not clear. And so as we go to formatting, I think that's part of this is what was recommended, what might the legislature have done, and then what has HCA or other state partners done in response to the recommendation, or if we've done something in response to the law, we can kind of be clear about what we're responding to.
Yeah.
With that, hopefully that will be better, but I appreciate you calling it out because I was getting confused there too for a moment. And even though I understood what was being said, it all kind of runs together. So thank you.
So you guys will, so this is not a final draft. There, we will have an opportunity to read this and provide feedback before this final report goes out. And then that's one question. And then I have another one.
Yes, you will have all week to provide feedback over email if you want to do a track changes version of the document, provide any kind of comment or feedback that way, because I did have a feeling that we all had a feeling that we wouldn't have enough time to really move through all of the comments and feedback during the meeting today. So any feedback that you want to provide between now and end of day on Friday, we'll be able to receive and consider for the report.
So consider means it won't be incorporated. And is that, am I hearing that correctly?
We can't just guarantee that we're going to incorporate every single piece of feedback from everybody. We have to make our own judgment calls sometimes about, you know, how to integrate things. But, you know, if there's not good reason to not incorporate, we absolutely will.
So, well, and you all are the determiners of that. Okay. And so the other question that I have then is that, am I hearing correctly? Because I just feel like there was a veiled, wow. So you guys are going to be implementing, from the HCA governmental perspective, you are going to be implementing what happened in section 2 of paragraph 8. So you are all viewing that as part of your legal charge as HCA then? Am I to understand that correctly?
I don't think HCA was given any directives in subsection 2.
Well, that there would be no insulation for harm reduction workers in like, even if they're performing HCA funded work and they are if a local jurisdiction creates a law that says that, you know, that work can't be done in the way that it has traditionally been done, that they're even though they're an activity that's funded by HCA, there isn't protection for those individuals, is what I'm hearing. Is what I'm hearing is the potential of this section.
Yeah, Malika, I think that's a good question. Sometimes what happens is when those conflicts arise, we will look at potential future legislation to offer protections or offer solutions to challenges as of that. Right now, I do not believe there's any agency request legislation related to that, but certainly as the committee sees potential challenges, we can take note of those. And this has come up, obviously, but there hasn't been action as of yet.
So we had a couple questions in the chat, one from Caleb. Caleb, did we get that squared away through conversation, or do you still have that question about subheadings and so forth? It sounds like we need to do some work on that from HCA's perspective. Anything more on that?
I think it's important, and the comment, I'll just say it rather than write it, is what I'm hearing from Malika, and this recommendation 5 is a good example of it, is yes, having clarity around what we said, what passed, what HCA is doing. And I would also request, I believe, and I'm not sure, but I believe our responsibility as SURSAC is to review the recommendations and implementation of the law that followed. And so if that's true, I would hope in the spirit of that we would have an opportunity to include the SURSAC members' responses to this. So for instance, to say that, the local jurisdictions getting preemption, the ability to preempt drug paraphernalia law is a radical 50-year regression in the progress we've made. And so I think something along those lines, that we have the ability to include our commentary on that somewhere in the formal report, I think would be appropriate.
Thank you.
Yep.
Appreciate that. So in the room there, hopefully we got that, talking about potentially more feedback from the group. Hunter's got a similar question in there. It sounds like we'll have access to the document. How are folks going to get access to the document? We're going to send it out to them, Michelle, or?
Yeah, the
Deanna?
committee members already received a copy of the document Friday morning. If anyone can't find that email or would like me to send a fresh copy later today, I'm happy to do that. But you all should already have a copy in your email.
Yep. Okay, cool. And then I guess the question is, kind of having that discussion now, but is there going to be any time once fully absorbed to talk about it?
Yeah, I think that we're going to continue. We are going to continue to have conversations about implementation for each of these recommendations. This week is where we are able to receive and integrate feedback for the report itself, but the conversations about implementation will continue, throughout the year.
Okay.
And I don't just mean 2023. I mean 2024 and beyond. Yeah.
All right. Thank you. Appreciate those. And, for note here, one more comment from Malika, making sure that we're following up on everything that we can. We've got somebody taking notes, I would assume.
Yeah. Yeah.
Okay. Thank you. Okay. I don't see any more hands up.
So we're at time, so I don't know if we want to continue the discussion or move on to R&P and just allow everyone to submit comments. You can email, you can do them in track changes, or you can email me any comments or concerns that you have or anything that you want updated in the plan. You can send those to myself and Michelle, and we will review those and incorporate as appropriate. So please send those our way. We're a little bit later in our timeline, so the quicker you can get to us, the quicker we can submit so it can be reviewed and onto legislature and the governor's office. So if we can have those comments, I don't know, how long do we want to give them, Michelle?
Friday.
Until Friday, until close of business Friday. Please submit your comments. Again, you can use track changes, or you can just email them to myself and Michelle, and we will review them. So everyone good? Move on to R&P.
James, did you want to make a comment, or you good?
My question got answered.
Okay, great. Thanks.
From well, not the video, the slide deck. No.
Thanks for your patience. We're just finding the right file here.
Well, that's being brought up. I will say that it was shared with me. There was an article, I think it might have been out of Columbia News or one of the local papers in Southwest Washington about RMP over the weekend. Maybe we can send that out to the committee as well. It was a nice article about recovery cafes and RMP and such. That, kind of cool.
Just the PowerPoint.
While we're waiting, were there any specific questions or comments in the plan that someone wanted to offer that we hadn't gotten to yet? For later on in the plan, I think we've got a minute to hear some more.
Caleb, I don't know if you heard that. Blake,
Yeah, sorry about that. Yeah. James, go ahead.
Is there any kind of accountability? Like the next recommendation was about like reporting on the RNP program. Is there any kind of accountability to try to ensure that local law enforcement is actually providing this program as an option or not taking advantage of it and making it seem like they are when they're really just maybe doing something different when they contact individuals?
Feedback on that?
Yeah, sorry, what was the question?
how are the accountability for RMP? So
For
are
law
law
enforcement.
enforcement using it, or they say they're using it, but does we really know if they're using it? So the monitoring of the RMP.
Yeah, James, I think at this point it's, this is Tony Walton, Section Manager for the Adult Substance Use and Treatment Section. It's a good question. I think, there's ongoing meetings with law enforcement. As far as accountability, I mean, the law changed, right? Like they're no longer required to refer individuals to the Recovery Navigator Program. RCW 1031-115 was stricken. So there's no longer that requirement. Now the requirement is, or the suggestion is that these cases would be referred post-booking, pre-trial through courts of limited jurisdiction. And that's an ongoing conversation we're having with the Administrative Office of the Courts, as well as our partners with the Lead Support Bureau as to how to support this new pre-trial diversion pathway. Obviously, I think everyone's in agreement that a pre-booking diversion helps keep an individual out of the criminal legal system and can get them access to services sooner and not have to go through jail booking and some of the other consequences that come with having a criminal charge on your record. But there is no more statutory accountability or requirement for law enforcement. But obviously, the Recovery Navigator programs being operational across the state, they have policy coordinating groups and operational work groups where they're engaging with law enforcement, having that conversation, trying to gain the trust of those in the criminal legal system so that law enforcement feels comfortable with making that pre-booking referral. So that's an ongoing process. We've been doing it, we're trying to implement it since 2021 when 5476 passed. Does that help?
Yes, thank you.
All right, Caleb.
I just want to make sure I'm understanding. Michelle, were you opening up like as you were waiting this for any comments on any of the other sections of the report?
Yeah, I just wanted to use the time that we had while we were waiting, but we are ready to do the Recovery Navigator program presentation now. So if you can share any feedback that you had at any, for any part of the report in the chat, or just wait till later this week, submit it over email, that would be great.
I'll put it in the chat. Thanks.
Great, thank you, Caleb.
Kimmy still got her hand up. We'll take this one and then we'll move on.
Actually, Blake, I think just in the chat, we need to move on to the Recovery Navigator presentation.
Oh, okay. All right, Kimmy, does that work for you?
Yeah.
Thank you. All right, great. All right.
Okay, so I want to start off this conversation with apologizing. I know this presentation looks substantially different than our previous reports for the quarterly report of RNP data, and hoping that through this conversation I can shed some light as to why that is. As part of the ongoing process of collecting data, we are continuously reviewing and analyzing our data to best represent the impacts that RNP has in the community and creating the most accurate representation. We're working with BHASOs and providers in our internal groups and data governance groups, and while incorporating feedback from SURSAC and internal reviews as we have made improvements over the last year. This includes updating to our data collection tool, refining our Power BI reports, and the ongoing feedback to and from the data governance team. However, the current dashboard is still under review internally and it's not ready for external publication. Regardless, we want to present some information to you at this meeting and explain some of the limitations in the data. So currently, numbers in the data reports are reflective of duplicate data and are represented as encounters total as opposed to the numbers of individuals served. The SURSAC and the HCA, we're very interested in understanding any demographic disparities occurring among referrals and connections to services, so those can be addressed. Knowing both volume of referrals and unduplicated data counts are important. This is an ongoing effort and a high priority for the program and the providers providing the direct services. So you will not be seeing demographic data in this current presentation. Data is currently, it is being collected, but again, it's being collected per individual encounter, which can be duplicative in nature, where one individual may be reflected multiple times in the data. The current coding that we have does not remove those multiple referrals for the same person. So we are unable to represent individuals served. We are not displaying demographic data in this presentation, but we are continuing to evaluate how best to represent the demographic data to be a meaningful depiction related to the individuals being served and not just a volume of total encounters. As stated previously, we're currently reviewing and evaluating internally on how to display the data in a more effective manner. We're working internally at the moment, and we will include providers and BHASOs when and if we need to make any updates to the collection and reporting of that data. As we have previously seen in July, we are working on a public dashboard for quarterly reports. We're still under review and will release as soon as we come to a consensus on the representation of the data. Next slide. So again, here's the statewide highlights of referral and outreach data. We have 736 referrals through law enforcement, and that includes diversion and social contacts. We have a total of 5,226 total encounters, with 2/3 of those being responded to within 15 minutes. Now I'm going to add another caveat on top of that, is that and you'll see that later on, is that the total number of encounters might be a little bit off due to some of our internal, the Power BI report that we use it's very sensitive, and so we did some things to the workbook that just didn't reflect yet in Power BI, and so the number count might be just a bit off. There's actually probably more to be counted. There is 366 in intensive case management and 774 in light case management. Again, data is based on encounters as opposed to individuals being served. The report is still requiring some updates in the coding that we are currently working on. Again, why we couldn't display the public facing site just yet, but we are working on it. Go to the next slide. So part of this coding is why you see asterisks and follow-up. There actually is a number, it's in the hundreds, but it's not being reflected right now due to us updating the workbook and it not translating directly into the Power BI report just yet. We are working internally, which just takes a lot of time to update the coding, and we were also going through an internal migration of the Power BI program, so there was just a lot going on, and that's why we just have a lot of missing pieces and thought that this was the best way to represent the data for the time being. We are hoping to present you the dashboard and more regional data later on. Just for this meeting alone, we wanted to be able to present something to you. And so this is what you're seeing. We are working on updating the language for contingency management. We can't necessarily update it in the workbook or for the providers, but we can update it as it's reflected. We know it doesn't reflect directly to the therapeutic services of contingency management. So we're hoping to have language in there that is more aligned with what they're doing. And it's pretty much just a monetary incentive for individuals, like gift cards or gas money or food, that is being provided. And so we want to be able to reflect that with more, with better language that represents what we were doing. Thank you. And so as you can hear is the statewide level of the services that are being provided, 1,145 peer support services, 464 transportation, 364 referrals for housing, 335 referrals to SUD, and 292 referrals to mental health. Again, these might be duplicated data. We are still working through that at the time. And go. I can slow down. Does anybody need me to slow down? I have speakers and I know we're a little bit late, so that's why I'm rushing, but if you need me to slow down, please just let me know. This is part of the statement that I was making earlier, is that we might have, we pulled this up, and this is a beautiful side-by-side that Ryan Keith, the RNP administrator, created. And I think it's an awesome representation of what is going on with the regions. Part of this is we're having Q1 and Q2 data here for statewide and each region, and having referrals and outreach and case management side by side. And again, these are individual encounters, not individual persons being served. But you can see that some of the regions are at or near capacity due to the overwhelming demand of services. And so you can see that they're making a slight shift away from the referrals and outreach and really providing a lot of case management for their clients that they're currently serving. While others are still building up their case management by having a lot more referral and outreach happening. As we were going through this data, we noticed that there was about 2,500 outreach individuals that were not being counted. This is due to us splitting the referral date and outreach date into two separate columns, and that wasn't directly coded into the report. We are updating it. I think it has been updated as of today, but the total number is an undercount of nearly 2,500. So we're probably closer to 8,000 referral and outreach statewide than the 5,000. Okay. So here are some of the updates over the last several months based on our own internal review and the feedback that we've received from the SURSAC meetings. We have added demographic data to the case management and updated demographic options that are reflective of BHDS to include options other than unknown and added refused and not collected. We're hoping to refine how we present the numbers of unduplicated people served. This includes working closely with the BHASOs and providers to identify alternative ways to collect and report. There are ongoing challenges to collect demographic data for referral and outreach. Unless it's already collected from the referral source, like law enforcement, outreach coordinators are focusing more on building rapport and relationships with individuals, while also working to better collect and report this important data metric. HCA is working with BHASOs and direct service providers to ensure that we are helping to address any disparities in referral and outreach. We are reviewing to make changes to, and like as I said, we are reviewing to make changes to contingency management so it's not directly related to the therapeutic intervention, and as it can also vary region by region of what case management means. Some do use it as a therapeutic measure, but some don't, and so we're trying to reach a consensus with that as well. And also the unknown, I know that was in a part of conversations during the last, I think, 2 reviews of this data. In regards to demographic data, and so there are several state data and HCA policies regarding small number suppressions that deem not presenting unknown essential to making this report a public document. But we are still reviewing ways to express and capture the demographic data in a more meaningful way. So the idea is that success can be meaningful and real on an individual level, even while it doesn't resolve systemic problems. And because of that, we're not ever really going to be able to capture it in our data. There is also not a good representation of how encounters are captured and how not all encounters are equal. So I'm really hoping that today we can see that in real life by getting some real success stories by Thurston County and King County. We would like to get to a good place with these reports that are more, so that these are more of a conversation and hearing from real people than me just talking about a whole bunch of numbers. So I think I have Thurston County. Do I have Thurston County on the line?
Yes, I'm here.
Hi. Would you like
Hi.
to speak?
Yes, thank you. My name is Sandra Kozlowski, and I work for the LEAD team at OHRS. And our LEAD program has been expanded to meet the goals of the Recovery Navigator program. The beauty of our program is twofold. First of all, we do get our referrals from the courts, law enforcement, and the community, but more importantly, we actually meet people where they're at. We go out into the field, we sit in the homeless camps, we sit by the side of the road, we meet people exactly where they're at, and that means so much more than physically where they're at. We accept folks if they want to be housed or unhoused. We work with a harm reduction model. We work with people who are underemployed or who choose to work full time. The most important components of our work is we move at the speed of trust, not compliance. And what does that mean? We don't produce compliance reports, but we work with allowing people to trust us, that we will help them do several things. One is harm reduction. Many times working within the harm reduction focus, people will then decide that they want to go to treatment. We get people housed. We do not have a housing program. However, we do have staff members that do the heat assessment, and we work to get people housed. 3, many of our individuals, once they become housed, can go to work or go to school. I think one of the most important things about our program is that we stay with people as long as they need us. So just because somebody gets housed, we don't then disappear. Just because somebody goes to treatment, we don't disappear. When they go to inpatient treatment, we're waiting for them when they come out. And we work towards stabilization and to reduce recidivism. We also partner with several agencies, the Salvation Army, Union Gospel, Catholic Community Service, medical providers, our own host program, Safe Place, and Innovations. So our program, the best results that we have had is when people become housed and then they let their friends know. And within that, within the houseless community, the Thurston County LEAD program is well respected for staying with people and treating them with dignity and respect to get the work done of helping them build the kind of life that they were hoping to build. Thank you.
Thank you.
Thanks, Sandy. We were also going to have the Mason County program speak for a moment. I think David's on the call.
Hi, good morning, everybody. My name is David Jarvis. I'm with the Mason County OHRS Jail Diversion Program. I was asked to provide a success story, and thinking about the various clients that we serve, a fantastic success story is an individual that had been using substances for over 30 years. And through the efforts of the program here, she went through treatment and is currently remaining sober. She is housed and employed and continuing to do really well. So we're very excited for that person.
That is awesome. Thank you. Is that it from Thurston Mason?
Yes, we could hand it over to King now. Thanks.
Okay, well, thank you so much. Rachel, do you want to? So I'm going to, Community Passageways has sent us a video to provide. And then rewind. I don't think it's muted.
RNP is the Recovery Navigator program. We support individuals that are experiencing mental, behavioral, and substance use afflictions. We help to navigate getting resources with basic needs, referrals to treatment facilities, warm handoffs to either permanent or temporary supportive housing or transitional. We really just provide a whole wraparound support effort to our participants. RNP is one of the newest programs under Community Passageways, and we actually started in August of last year. We experience a lot of people who are in crises every single day. They wake up in crises. We are there to essentially meet them where they are, right? We walk with them day by day, step by step, in order to get to those bigger goals, which 100% of the time is stable housing. You know, having my family being afflicted by substance use and mental health, it's personal. I really want to make sure that we're helping everybody on every level. I lost a little cousin to substance use addiction in 2020, mother of 4. I know how, you can feel like your efforts and your love and all your support is going to waste, but it never is going to waste. As long as we maintain that consistency in building those relationships, it might not be today, it might not be tomorrow, might not be next week, but as long as we're still there and showing up every day, then the chances of them, seeing that, feeling that, and wanting to do better for themselves, the chances of that are highly likely once we're developing those relationships, which is what CP is known for.
And right now we're doing a outreach pop-up tent and hoping to provide some direct services to the public and some resource navigation. and just making our presence felt out here to the businesses and the other individuals in this community. Anyone's welcome to pull up, and we're giving away some sandwiches and hygiene kits. Anything I can do to, unfortunately, help maybe restore our city to the greatness that it deserves. Anything to empower people, to show them that somebody's fighting for them. That's huge because it's made such a difference in my life. You know, just knowing somebody has your back, sometimes that gives you that extra nudge forward to keep going, keep searching for stability and success.
We have King County on the line.
Yeah, this is Susan, and I just also would like to give Alexandria, who was in the video, just a minute to share as well.
Hello, everyone. Thank you for, I'm happy to be participating in the SURSAC meeting. We here at Community Passageways, much like Sandra was saying, we incorporate a lot of those same policies and the same philosophy in the work that we carry on with each of our participants, just really focusing on building the trust that allows us to have those deep, lasting, meaningful connections with, with each of our unique participants. We really take pride on providing, compassionate, holistic, one-on-one, really individualized care for our folks. We're really fortunate to be able to serve the community, that grew up in. I'm currently here at our Direct Services Resource Center on 23rd and Jackson, where we have a huge need here, and we're here every day making those touches. One of the biggest, we really like to share, a little bit about our why and what keeps us connected to this work, because we know that, this work is difficult, it can be challenging, and, a lot of times it can be heartbreaking. And one of our first RMP participants, who was one of the first success stories that we actually shared out, she recently passed. But, she was really, like I said, she was the first success story. She was, living unsheltered with co-occurring disorders. We were able to, after about 4 months time, get her into her permanent supportive housing. And, going through that with her was just really, truly amazing. From her living, in a tent on the side of the road. And so I wanted to just really quickly share, she used to always send, like voicemails and messages, to, just to show her appreciation. And I want to be able to share that really quickly. So, I just want to confirm that everybody can hear.
Hear you. I'm not sure we can hear the tape yet.
Okay. Let's see. Okay, let's see. I hope everybody was able to hear that. Oh, no? Oh, goodness. Okay. Well, I'm sorry, but maybe I can share out later, but thank you all.
This is, I forgot to introduce myself. I'm Susan, am with the Recovery Navigator program for King County. And my apologies for not introducing myself earlier. But next up, I would like to ask Reach and Dawn Shepard to come forward with her success story. And then we will have Pierre Washington behind. Thanks.
Thanks, Susan. Alex, I love that video that you all made. My name's Dawn Shepard. I use she, her pronouns. I'm the RNP program manager at Reach. Reach has been working with people who live outside, who have acute medical, mental health needs, and who use drugs since either 96 or 97. I can never remember. We are the originators of the LEAD program. So when the RNP program was designed, it was designed based on a LEAD model. So when we started, excuse me, when we rolled out the RNP program, we actually integrated with the existing LEAD program at our agency. But what we did do with the RNP funding was we moved LEAD into areas that have historically always been underfunded in Seattle. So we just opened a new office in the Rainier Valley where there has never been more of a need for pretty much everyone that lives there would qualify for our program. I was going to tell you one of our most recent stories that's a huge success, but I think I'd rather tell you about a client that I started working with when I was doing outreach in 2019. And this was shortly after I got out of prison for having used substances for about 15 years. And wanting to be that person that sees someone that I didn't have in my life. So I started working with this gal. I'm going to call her Colleen. She is a 37-year-old white woman. She was a victim of domestic violence as a child. She had a pattern of relationships with men outside that were violent. And throughout the 3 years that I worked with her doing light touch case management, she did try off and on to extricate herself from those relationships, but it was a struggle and she always ended up going back. When we rolled out the RNP program, I did a community referral for her, and she was connected to one of the case managers that now works under me. And her story is like, you think of somebody and the whole idea is housing, employment, sobriety, but what it takes to get someone to that point who's been living outside for a long time, who's been conditioned by a lot of things that are culturally happening on the street outside. It started out, it was so hard for her to sit through anything with her case manager. She had so much anxiety, so much PTSD. It was very difficult for her to get away from her partner who always was trying to isolate her and who never wanted her to have any outside support. And so she also experienced a lot of trauma just going into like public agencies, right? Like if you walk into a public place and your hygiene isn't good, or, you know, your behavior is not the normal expected behavior, people really respond to you in a negative way. So initially, her case manager started talking to her about getting her on food stamps and trying to get her ABD, which is the Adult Blind Disabled temporary small financial assistance for people who are trying to get Social Security. It took 6 tries to get her to be able to sit through that first interview with the social worker and do the psych evaluation. But because her social worker kept showing up and taking her over and over and over, she was able to finally sit through that evaluation and get that subsidized support. What makes that really significant is that over the years that I worked with her, she would talk to me about wanting to stop using drugs, but never felt like that was going to be possible as long as she was in the relationship she was in, because he was the dope man. And he held that over her head. He used that as a form of control. She also had open warrants, so he would threaten her with those warrants whenever she wanted to leave. So it was like it's a really messy situation for everyone who finds themselves this deep into homelessness. And so it started out, she was able to get a little bit of independence by having just that small amount of financial support that was hers. Because she was enrolled in LEAD, she then was able to, after a particularly violent episode with her partner, was able to get housed with co-lead. So she was able to go into temporary motel housing that way. She continued to work on getting her ID, getting her social security card. She is now actively enrolled in mental health support. She is like managing to take medication on a daily basis, which she's never been able to do before in her life. As of 2 months ago, she was housed permanently in a very nice new building, in the only 2-bedroom apartment that they had, because she does have children, and that's part of her long-term goals, is reuniting with her kids. She continues to work with her case manager on all things that involve trying to get into school, trying to find employment. She has not talked to her abuser since that last when she was moved into the co-lead program. That was almost 4 months ago. She's had no contact with him whatsoever. This particular client is so near and dear to my heart because I grew up in very similar conditions, and I spent most of my life with abusive men as well. And I know how hard it is to get out of that situation. When I was working with her outside, several times we tried to get her into domestic violence shelters. And I have to tell you, it's one of the biggest gaps that we have in our social service system altogether. I have never, in all the years that I've worked outside with people, ever one time been able to get somebody living outside into a domestic violence shelter. It's never happened for me or anyone else I work with. So my whole point being that we've been able to use the RNP funding to go into areas that we never would have had funding for LEAD. And we've been able to impact the lives of people that we've been trying to work with we haven't been able to get anywhere, because outreach is a light touch case management, right? Like, an outreach worker is really just trying to help you stay alive. Intensive case management can show up for you every time. And I have every confidence that she's going to keep doing that work, and that she feels empowered now to keep moving forward. And she's expressed that over and over. I wish I could have thought ahead of time to bring forward a voicemail. Alex, that's a great idea. But I just wanted to share that with you. We have so many success stories already, and this program we haven't even really gotten traction and rolling yet. It takes a long time to stand these things up, but I've seen some really amazing things happen already. And it's not that the work hasn't already been being done, but it's not being done enough. So I really appreciate you all sharing the success story with us, and for the efforts of the RMP program as it is. Thanks.
I'd like to introduce Kimmy Reedy, and I believe you have something to share with us, and possibly another person to introduce. But thank you.
Hi, everyone. I'm Kimmy Reedy, the project manager, program director for South King County and Expansion Recovery Navigator Program. And instead of reiterating somebody else's story, I have with us a participant today, Jordan, who would like to tell you himself about his experience. So, Jordan, would you like to come on board?
Hello. I'm a little nervous, so bear with me here. But my name's Jordan. Thank you guys for having me. I'm gonna read a little something that I wrote for you guys. I am a success because of this Recovery Navigator program, and I'm so thankful for it. My name's Jordan. I'm an addict. By myself, I'm powerless over my addiction. In recovery, one of the first things we do is admit to ourselves that we're powerless over our addiction. For some of us, that's a hard thing to do. For me, I've known this for a very long time. Looking back, I realized that I gave into that powerlessness for entirely too long. I'm the kind of addict that when my disease has my mind at dis-ease, I hit rock bottom and keep digging till the shovel's broken and ask for another shovel instead of a hand to get out the hole. It took entirely too much for me to finally get out of that hole. I started using in one form or another when I was about 16 years old. I'm 32 now. When life kicked me down and I wasn't comfortable in my own skin, I smoked or snorted a hug. Violence, death, relationships, trauma, whatever I went through, I felt like drugs made it easier for me to cope. When life was good, I wanted it to be better with drugs. And for a while, I thought I was a functioning addict. But I realized real quick that things are only functional until they aren't anymore. And the aren't anymore always comes. Funny thing is, I thought I had hit my rock bottom before too, and thought I'd never get back to it. I thought that leeching money from my family, couch hopping, and sometimes staying in abandoned houses was my lowest of low. And I was wrong. I got clean for a good while when my daughter was born, that day, actually. But I wasn't in recovery or working in program because I thought I could do it on my own. I was my own higher power. I stayed clean from my drug of choice for 5 years, but I was still, as some addicts know, California sober. Being a single dad was the only thing keeping me from falling off. I had put in zero work on myself. I was still of the mentality that when she was out of the house someday, I'd probably get loaded again. And I thought that I'd be able to control it. And I don't even know why I was of that mentality. So when I lost the ability to be a father, the only thing that was really keeping me sober, everything went to hell. When I fell back off, heroin wasn't really big anymore. It was actually pretty hard to come by. So fentanyl and Xanax ended up being the go-to for me. And I was still on the methadone program, and I worked it so that I could get more loaded. At first, the spiral was gradual. I had a place over my head, a car. I was working still, but that spiral went straight down really quick. I was on and off the streets. I was one of those people living in the tents for a while. That was on that video. I wasn't in the video, but I was just like one of those. I was selling and using just to get through the day, 20 plus hour days of the street life just to survive. I lost everything, my family, my home, my car, my job, and worst of all, majority of my morals. When I tell you that I kept digging at rock bottom, I really mean it. I was rolling around with affiliated people, seeing things you would really think that were just in the movies, going to places that most people don't even know exist, locked behind bars multiple times. Every single time I came out from being locked up, I just went right back to that life because I didn't have support. I never even thought of my family or rehab and assistance as an option until I almost died violently. For whatever reason, the countless overdoses were never enough for me. 3 days after the last time that I got out of jail, I got beat up so badly by a guy with a medieval mace that I nearly lost my left eye, and I have a brain injury that I'm still dealing with. That being said, I'm thankful for it. He hit me so hard that it woke me up. Right after the hospital, I went home, and then I went home. And what I mean by that is I went home to see my sister. She connected me with the amazing people of the Recovery Navigator program and other programs. I went to rehab shortly after. And once my injury was at the point they could legally take me, I graduated rehab and found my second home with 12-step programs. Now I know anyone out there, because for me, some of these things sounded cheesy to me. And I was definitely still thinking like my addict self, but I kept coming back. And now I'm the one that spouts off these things that I thought were cheesy. Why? Because it works. Today, October 2nd, I have 8 months clean. That's the longest that I've had fully clean from all substances in 16 years. I now have actual friends that are more than friends. I have a fellowship of people that really give a damn about me, and I can be vulnerable and care about them and it not be a transactional relationship. I used sober living, these programs, amazing support from everywhere that was newfound as a stepping stone as intended. I continue to utilize and stay in touch with all the programs I've been blessed with. It's amazing to have people like those at RMP to be a voice and to be able to be of service through them if needed as well. Tangible things have finally started to fall into place for me, and I'm finally proud of the things that I'm doing. A year ago, I would have never thought for a second I would be leading meetings, creating new meetings in King County, doing H&I panels, working the steps in the STEP program in my own place, starting peer counseling training and preaching 12-step programs. But here I am, and I'm super happy about it. And happiness has felt foreign to me for so many years. Addiction is a messed up disease, but I'm glad to be an addict today. Any other disease, you can only hope to get back to the health you were at before. With addiction, working recovery, you can become better than you ever were before. Every aspect of you changes, and it sounds scary and insurmountable at first. It really does. But that's why there's so many other addicts that have done it, and in 12-step programs and in these RMP places, and people that are an advocate for us to help. Mental health that helps specialize on addicts, that really helps. And these programs help you get in touch with that. And let me end on this. Every addict can do this and more. We can't do it alone. Don't let your mind fool you into saying it can. Complacency is the enemy of success. Iron sharpens iron like one man does another. Be susceptible to letting yourself be sharpened. I found my Midas touch through these support systems like family, rehab, and the peer programs, exposing my defects and wrongs and turning them to gold. I urge everyone to find their Midas touch. And that's all I have. Thank you.
Thank you so much, Jordan, for sharing. That was wonderful. I think that was it for us. So thank you so much for everyone.
Go ahead, Brianna.
And I was just thanking everybody for joining us today and sharing your stories. They're really, really meaningful and very impactful and really show what RNP is doing out there. So thank you. Go ahead, Blake.
Yes, thank you very much. Thanks, Brianna. All right, so we are almost at time. We have time for a public comment, if anybody would like to make one. Did Shelley? No, Shelley? Okay.
Yes.
Oh,
Yeah,
yeah, okay.
I was clicking it and nothing was happening on my end. Hi,
No worries.
I just wanted to pop on here real quick and maybe ask for, I know I'm not a committee member, but maybe ask for in the future. It seems like more time could have been allotted for the review of the report and collecting feedback from the committee. That's a large part of the committee's duty. And I really would have loved to have seen almost the whole meeting being dedicated to allowing the committee to go through this report as a whole. And so maybe in the future, if we could, A, get the report out more than one day, business day ahead, and two, to give the committee a chance to go over this collectively together in the whole meeting. Thank you.
All right, thank you. Appreciate the comments. Okay. Rep Taylor, one more.
Thank you. Thank you, everyone. I just want to reiterate, I've been, fire in this chat. I am really hearing the feedback around the process on Senate Bill 5536 and comments made by my colleague, Rep. Davis, around the process and the accessibility. I want to reiterate for everyone, please, independent of this body, your organization, or a coalition you're associated with, please reach out to members directly. Please reach out to us. There is a lot more work to be done, and there are opportunities to correct the negotiations that are problematic. And I haven't specifically been contacted over the summer. I know folks just needed to catch a breath, as I did, and I'm hopefully, I'm hoping that folks will reach out this fall for follow-up legislation.
All right, thank you very much. Michelle, back to you.
Yeah, so we're pretty much at time, but I just wanted to say in terms of next meeting agenda items, I will be in touch with committee members to talk about how to do priority setting for upcoming meetings, get the kind of feedback that we're hearing today about time allotted for different items and things like that to make sure that we have that spaciousness in the future. So I will be in touch around that, and that will include a debrief of the panelist discussions that we haven't yet had a chance to talk about. Spent a lot of meetings hearing from folks, and so we definitely want to loop back to that. But that's all I have for now, and we'll just hand it over to Michael for closing comments.
Thank you, Michelle. Thank you, Blake, and all that contributed today. Jordan, I think you inspired us all with your testimony today, and know that we're all behind you in your continued success. It takes a lot to come on and share, and really appreciate that. All the Recovery Navigator administrators and outreach workers and everybody working in the program, thank you for your support today as well. In terms of the plan, committee members, we do want to hear from you in terms of how we can make the process better. We learned a lot today in terms of just formatting issues and timing issues and things of that nature. Once we get to a point of wanting to talk about individual programs efforts, we can certainly bring our subject matter expert in, the folks that are working the contracts with those individual programs, and give you a whole lot more detail than we're able to today. So I just know that is available, and it's really about scheduling and making sure that we're getting the right things out there and paced at the right time. But thank you all for leaning in, and I know we're at time, a minute over, so really appreciate it, and have a great start to your fall. Take care.
Everybody.
Thank you.